People who know me well generally agree that I have bad luck. My bad luck started on the day I was born, the same day my identical twin brother was born. The unlucky part about that is that I was the second born twin. Second by a mere minute. As any boy with two brothers close in age can attest, seniority is everything, and I was lowest on this hierarchy. Okay, being the younger twin isn't that bad. I've always been grateful to be a twin. My first true experience with bad luck occurred when I was 15. I was flung from a go-kart and collided with the tailgate of a parked pickup truck. My knee absorbed most of the impact, and I broke my femur just above the knee. After the bone healed and I was allowed to bend my leg, I wasn't able to. Scar tissue had stiffened the knee joint, leaving me with only about 50 degrees of flexion. I then broke my kneecap in physical therapy, trying to force my knee to bend. The wire that was weaved throughout my kneecap to mend the bone became infected with MRSA, a strain of staph infection that's resistant to most common antibiotics. As the infection spread throughout my kneecap, into my quad, and throughout other tissues, the only option was to cut the infected areas out. Doctors were eventually able to remove the infection, but I was left with a gaping hole in my leg. You could literally see my bone from here to here. To cover the hole, doctors removed 3 of the abs from my stomach and attached them to my leg. And finally, after 18 surgeries and 18 months, I was able to start healing. I still can't bend my knee more than 90 degrees, but it doesn't prevent me from doing many things. I was still able to play football, I can run on it, I can do just about anything. I just can't bend it, which is good enough for me. My bad luck continued when, as a healthy man in my mid-20s, I was diagnosed with cancer, testicular cancer. Luckily, we caught it before it spread, and we were able to remove the cancer with 1 surgery. And most importantly, I was left with 1 healthy, fully functional testicle. 6 years ago, I married my high school girlfriend, and we moved to Dallas so I could attend law school at SMU. We always planned on having our first child the summer after I graduated so that she could stay at home and raise the baby. And as planned, she got pregnant in January, and I graduated in May, took the July bar exam, and found a job. Everything was going according to plan. Until September 24th, 2012, the worst day of my life. We had an afternoon sonogram scheduled. It was just a standard checkup, but my wife and I soon realized that something had changed. The very, very talkative nurse wasn't talking. She got up and told us the doctor would be right in. The doctor came in and told us our daughter had hydrocephalus, meaning she had extra fluid on her brain. He was vague about what it meant for her down the road, but he was very clear that within a month of coming out of the womb, our fragile, precious little daughter would have brain surgery to insert a shunt in her head to release the extra fluid. The same day, my wife and I went to an imaging center to get a sonogram of her leg. It had been bothering her for months, and for some reason she was concerned it was a blood clot. Sure enough, it was a blood clot. She was immediately admitted to the hospital and would be on bed rest and intravenous blood thinners until the baby was born. We scheduled a C-section for exactly 1 week later. In the meantime, I met with a pediatric neurosurgeon. He told me that our daughter had an equal chance of falling into one of three groups: severely disabled, slightly disabled, or mostly normal. It was too early to tell me any more without pure speculation. The week leading into my first child's birth, I was in a state of severe depression. The dream life I had always imagined and had worked so hard for collapsed in an instant. I kept asking myself, how can I ever be happy again if my daughter's brain doesn't work right? Embry Suzanne Higgins was born on October 1st, 2012. I was so happy to be a father. But the joy was tempered by fear and anxiety. Will she ever read? Will she ever be independent? Will she ever have friends? Will she ever be happy? The second worst day of my life came 10 days later. New scans of Embry's head confirmed that she had excess fluid in her head. But now the doctors didn't think it was hydrocephalus. No, it was worse. She had cerebral atrophy. Her brain was wasting away. Her head circumference measured off the charts. The doctor explained that the fluid in her head was causing her head to expand, but her brain to shrink. He told us to prepare for her to have special needs. 2 months later, we had a more detailed scan, which would hopefully answer many of our long-term questions. This is when we got a final diagnosis: benign macrocephaly. Basically, her head was really big, and she had more fluid in her head than most babies. But, the doctor explained, her brain's size was perfectly normal, and it was functioning perfectly normal. Benign macrocephaly means harmless big head. She had a big head, but it was harmless. There was nothing wrong with her. It turned out that all our fear and anxiety was for nothing. In fact, had we not opted for an extra sonogram, her big head would have never been noticed or pointed out to us. Because her height and weight also measured off the charts, she was proportionately big. Now we have a baby boy due in September. We have a happy, healthy 2.5-year-old daughter. My wife is living out her dream as a stay-at-home mom, and I have a job and a family that I love. So, I've had some bad luck in my life, but I feel like the happiest man in the world.